Thank you very much for the introduction. And thank you to the organising committee for inviting me here. It really is a huge pleasure and an honour to be giving one of the plenary keynote speeches. I would just like to pick up on the last point that you made. It was my honour for 6 years to be chairman of the steering committee for the EPIET programme from 2001 to 2006. And one of the first things I had to do as chairman of that programme when it was 5-6 years old at that point, was actually defend it against cuts. It was being proposed that it should be cut, and we successfully defended that. And as I hope I will show later on, it is the seed from which much of European collaborative epidemiology has grown. And I really think we have in this room the seed to grow that same collaborative community in the MediPIET region. So I absolutely echo what you say. We are not too small. Most things start small, and if they're successful, get bigger, and I hope that is what we will see here. So, just a couple of words about where I work. Hopefully many of you will know about ECDC, the European Centre for Disease Prevention and Control. We're 10 years old this year. We were founded in 2005. We've got nearly 300 employees. And our mandate is to identify, assess, and communicate current and emerging threats to human health for communicable diseases. And that means we do many things: surveillance, provide scientific advice, but particularly we have a key role in providing training programs and developing capacity. And Carl is the head of our unit that does that. So we are really, really interested in the work of this network. What I'm going to talk about today, just to map out the outline, applied epidemiology as I see the fundamental science that underpins not only public health, but actually clinical medicine as well. Historical perspective and the modern context, something about threat detection and response, which is at the very heart of what we do, the application of public health science, what we do now, some of the exciting opportunities that we face, and then finally a few words about field epidemiology training in the international context. Applying public health science in the field is not new. It's been going on for over 150 years. And this man, I'm sure, hopefully many of you will recognize, this is John Snow, who 150 or more than 150 years ago, through basic sound epidemiological practice, identified the source of an outbreak of cholera in the Soho district of London and took action to prevent it. And unbelievable though it may seem to some of you in this room, he did that without computers, without the internet, and without whole genome sequencing. It can be done. I'd just like to also introduce you to another personal hero of mine, and that's William Farr. He worked in the what's called the General Register Office in London, and I see him as the father of modern surveillance. He was the first to derive mathematical model to describe epidemic curves and actually use them for prediction. He invented the standardized mortality rate, and interestingly, he actually ordered what was called then a difference engine, that's the very first computers, from Sweden. I'm not sure if he ever used it, but he ordered it to help him calculate standardized mortality, and he used life tables to estimate effects of prevention on expectation, and so on and so forth. So these two, both working in the middle of the 19th century, really showed how the application of public health science can be used to improve health, to improve public health. Of course, the world has changed enormously in the last 150 years, and perhaps in no greater way than in terms of international travel. We can now travel from one side of the world to another in a shorter time than is the time of the incubation period for most infectious diseases. This creates huge potential for pandemic spread, and it's the reason that we need networks of epidemiologists working around the world, communicating and working together if we're to contain such pandemics. And one of the most obvious examples in recent years, which has already been mentioned, is the MERS coronavirus outbreak, which started in 2012 in the Middle East and is still ongoing, demonstrating just how infectious diseases can spread around the globe. And there's still some really important questions that can only be answered through sound epidemiological studies if we're to really understand some of the factors behind the continuing transmission and ongoing epidemic. And it's not only people that travel widely. Goods, and particularly foodstuffs, have a global distribution. And I'm not asking you to look in detail at this slide, but this is actually an analysis done by the European Food Safety Authority into the food chains, the supply chains of fenugreek sprouts, which are associated with the largest E. coli outbreak, EHEC outbreak that we've seen in Europe, occurring particularly in Germany in 2011. It just shows the complexity, and although you can't see from this, the speed with which foodstuffs move around. And we only can hope to understand this and investigate and identify sources by working together when both people and food move so rapidly between countries. And finally, communication and communication technology has moved on hugely, so that when events do occur, they rapidly get onto our television screens, into the newspapers, with the expectations that we, all of us as public health professionals, identify the source and help to control and contain these epidemics rapidly. And we all work with those growing expectations. And it's only through working together that we can actually meet those expectations. Now, as I say, at the heart of what we do is threat detection and response. That's how we largely apply public health science as epidemiologists. And really, there's not a big difference between how that works at a national level or an international level. It's the same core building blocks to what we do. Event detection through sound surveillance, assessment of the threat, and threat management. Often, that occurs at a local level, sometimes at a national level, and sometimes it happens at an international level. And at the heart of threat detection is good surveillance. Now, you can see here the circle indicator-based surveillance. This is the collection, usually of structured information, most often from healthcare sources, where we subject the structured data to statistical analysis processes to create signals and identify potential threats. And I'm sure that's what many of you spend much of your time doing. Of course, we're now seeing more and more emphasis being put on event-based surveillance, where we're working with often less structured data collected, often in a less systematic way, where a major part of the process of epidemiologists, and this is where we apply our skill, our knowledge to interpret data, is about actually filtering out the noise from what's important signal, validating the data, and thereby detecting threats. And of course, once we've detected those threats, it's really important that we communicate those. And that's not just communication to those responsible for taking action in our own countries, but also communicating it within our own community, so that we're all aware and can be prepared and can take part in coordinated global response. So, I was asked to talk about the application of public health science in field epidemiology. And of course, the key roles of scientific evidence in disease prevention and control are really related to the risk assessment process. What's the risk of introduction? What's the risk of spread? What is the likely impact of spread, both in terms of morbidity and mortality? What is the capacity to respond? What are the available interventions? And what are the costs likely to be to individuals, to health services, to the country as a whole? So the next few slides, I just want to run through some of the current activities, particularly the ECDC are undertaking, but not just ECDC, in all of these areas. So first of all, risk of introduction. This is an interesting new piece of work which is actually looking at the risks that actually Vibrio might be able to multiply and therefore pose a health risk, particularly here in the Baltic Sea area. So you have here a map which is color-coded according to the temperature, the sea temperature, and prevailing climatic conditions, which gives you an idea of the likelihood that Vibrio organisms will multiply in the seawater, thereby posing a potential threat to risk. I just put this up as an example. It's an example taken actually from the ECDC website, an example of how actually environmental sensing is becoming a reality. And I'm sure that we're going to see more of that as we move into the future. Assessing the risk of spread. Again, this is looking at the work that we do in Europe, mapping out the spread of West Nile virus. It gives insight into where the risk of acquisition are, but you can also see from the map by looking at where it's been in previous years how West Nile virus is spreading. And hand in hand with this, we've also been doing work looking at mapping out the vectors, the mosquito vectors for West Nile virus, again, as a way of assessing risk. Having assessed risk through surveillance, be it indicator-based or event-based, it's really important that we communicate. And what this slide shows that for many years, the traditional way of that communication was to produce large written reports, initially printed, and then more and more often as PDF documents that could be accessed on websites. These are fairly static documents. They still have an important role, and we still need to produce these documents. But we're now moving into an age where we're producing far more in the way of dynamic outputs. And so 2 examples here from ECDC. You can see on the top right there, what we call our surveillance atlas. This is an interactive atlas where you can actually look at a variety of parameters on diseases under surveillance in the European Union. You can drill down, look at age distribution, risk factor distribution, to provide more insight and allow people to tailor outputs to their own needs. I think also very exciting is in the bottom right-hand corner. We've recently launched an HIV modeling application, which actually allows you to plug your own national data in to make predictions about the likely impact of disease. And I would say that modeling, mathematical modeling, is an increasingly important part of public health science in terms of our understanding of disease and the impact it can have. And this is just one example. We're also going to very soon be launching on our website a burden of communicable disease model, which again will allow you to plug national data into the model to estimate the burden of disease in terms of disability, adjusted life years, and mortality. Health economic analysis. As public health scientists, I think we all know about the importance of good epidemiology, undertaking good epidemiological studies, about having sound statistical analysis. But I think if we are actually to influence policy, and policy is really important in this area, one of the most effective ways of doing that is by actually presenting our findings in terms of health economic analyses. What is the financial impact of a disease? What are the potential benefits and savings that come from an intervention? And in ECDC, we've done a certain amount of work in this. Where I worked in the UK before, it was right at the heart of the National Centre's work that I did, was actually health economic analyses, and it had a huge impact on policy making. And I would argue that actually health economic analysis is a really important part now, an increasingly important part of public health science. And also in terms of communication, of course, we communicate with a wide community. We communicate with each other, we communicate with policymakers, but we also must communicate with the public. And this is an area that I've really grown to appreciate since coming to ECDC, and Carl's unit have very much been in the lead of this, but we call it infographics. But I think infographics is a really powerful tool for communication. And so this is just an infographic which we recently produced to talking about the iceberg, that the fact that what we detect in terms of surveillance of salmonella infections is just the tip of the iceberg, that in reality there are many, many cases that go unnoticed. And I think this is quite a nice way of presenting it. We have many other infographics, some great infographics that were produced last year during the Ebola response, which very clearly in one simple graphic gave an awful lot of information about modes of transmission and the actions that were needed to take to reduce transmission. Big data. This is a really exciting time to be an epidemiologist. It's an exciting time, but I have to say many of us feel like this big data, by big data I mean the use of social media, Facebook data, Twitter data, internet search logs, Google-based data, as well as large data sets that are going to be derived from whole genome sequencing. We kind of feel this big data is coming at us a bit like a tsunami. There are huge expectations that we should use it, but how do we use it? And I think you in this room, you're the generation that are going to actually find out how to use it and show people like me how we can use it. And one of the reasons that there's so much interest and excitement about big data is particularly things like Twitter and Facebook and self-reported illness is that it gives us an opportunity perhaps to get a very early insight into the emergence of infectious disease problems. In general, in infectious disease surveillance, where actually outbreak detection and control is a major part of it, the earlier the data that comes to you, the greater utility it has. And so that's one of the reasons. But we need to be cautious. Real time doesn't mean reality. And it's also true that quite often the very first data we get aren't necessarily completely accurate. And actually, time often needs to be taken in cleaning and validating data before we can use it. And an interesting example, of course, was a few years ago, the Google Corporation started publishing their flu trends reports, where they made predictions about seasonal flu epidemics for the next few weeks. And for the first season or two, this was a very successful initiative, but of course, there was then the issue that they overestimated by a factor of 2 probably at least, where the flu season was going, with an massive impact, particularly in the USA, in the flu vaccines running out, and as the Nature article says, when Google got flu wrong. And in fact, the last year or two, they've not produced any outputs, although I heard at a conference last week that an organization is looking to perhaps take this on in the future. So, huge opportunities, but dangers. And we really need to work together to work out how best to use these new data. That's not to say that they don't have value. And again, if I look at the recent Ebola outbreak, in fact, it was in fact early news reports, internet-based news reports from the BBC, from African news services that gave the first insight into the evolving outbreak. And was actually, these were important sources of information for ECDC's first risk assessment on the Ebola outbreak. And epidemiologists are using these data. These are just a couple of examples from major medical journals. Tracing a syphilis outbreak through cyberspace. This is using social media data to actually track an outbreak. Social network is an outbreak investigation tool. And even in the field of foodborne outbreak investigations, these data have been used. So they are becoming a reality, but we need to be cautious in how we use them. We need to learn how to use them. Now, another big data, that's the data that comes from molecular diagnostics. I've mentioned whole genome sequencing, but of course there are many other genome-based diagnostic technologies. We have a molecular surveillance strategy at ECDC, when we've developed various cluster search tools so that actually we can make use of the data being generated by these new technologies. And I think it's going to be very much part of the future. And interestingly, there's a paper in the New England Journal a year or two ago where actually the investigators used both whole genome sequencing and social network analysis to actually get insights, unique insights into the tuberculosis outbreak. And so that's bringing together two big data sources to actually provide greater insight. But all of this is very exciting, and it is part of the future. But can I just a word of caution? Basic field epidemiology, field investigation of the sort that John Snow did back in 1854 is still really important. And as an epidemiologist should never do, I'm going to now use personal anecdote to explain why I think that's the case. A few years ago, many years ago, I investigated an outbreak of salmonella in a hospital in the UK. And the case control study suggested it was associated with salad that was put in sandwiches in the hospital. But no one could understand how was the salad contaminated with salmonella. It didn't seem at all plausible. But as part of the investigation, I did a kitchen inspection. I went to the kitchens in the hospitals where they made the food for the hospital. And I noticed in there these big silver dishes. And I said, what are these big silver dishes for? Because they had salad. They said, well, we put the salad in that before, once we've washed it, we put the salad in that, and then we take it from that and put it in the sandwiches. I said, oh, that's interesting. I said, do you use them for anything else? Oh, yes, we use them for defrosting the chickens. And it was simply they had defrosted the chickens in there, not washed them, and then put the salad in. And I'm sorry, no amount of big data is going to give you that. So we need to learn how to use big data. It's going to be part of the future. But it will not replace basic field epidemiology. So please, it's really important to get out there, to visit the sites, not only talk to patients. You get so much information from talking to patients, but also visit the sites if you've got an idea of where transmission may have occurred. Finally, I'm just going to talk about the global context again, particularly looking at field epidemiology training in the global context. We live in a global society, and as Kofi Annan said, it's been said that arguing against globalization is like arguing against the laws of gravity. And infectious disease prevention and control is a global activity. It's also a multidisciplinary activity, and I think we need to recognize the importance that actually effective prevention and control of infectious diseases requires epidemiologists, microbiologists, it requires statisticians and mathematical modelers increasingly, veterinary medicine specialists, environmental scientists, behavioral scientists, economists, goodness knows how many more. But I think those are the main core disciplines that we increasingly need to use. Of course, infectious diseases don't respect borders. They don't respect geopolitical borders. They don't respect species borders. And we've already heard about One Health, and I think One Health, again, is important. Because for me, the biggest infectious disease threat for the medium to long-term future is antimicrobial resistance. That if we don't contain antimicrobial resistance, if we don't stop the trends that we see at the moment, in 20 years, we won't be able to treat cancer. We won't be able to do transplants. We might not even be able to replace hips. And at a personal level, that will be really important, because I'm sure it's only a matter of time for me. So that's an area where we really need to work. And of course, working with our colleagues in animal health is going to be so important in that. Effective communication and coordination are critical to multidisciplinary and multinational working, and timely and accurate information sharing is really important. Now, This is a personal view, but I think that the kind of the prerequisites for successful international collaboration is we must have appropriate capacity and capability in all member states. We need standard methods, we need effective surveillance systems, we need to be able to share epidemic intelligence rapidly, we need open communications, and joint training and joint exercises are very important to effective collaborative working. Most of all, you need trust. The speed with which infectious disease outbreaks move around the world means that we have to share information rapidly. We have to do that in an open way. And really that requires trust. And if you look at those prerequisites for success, and then you look at the key objectives for most field epidemiology training programs, I think you'll see there's a pretty good read across, a pretty good match between the objectives of field epidemiology training programs and what we need in terms of ensuring successful international collaboration. And that's why I think initiatives such as MediPIET are so important, because it's through these initiatives that we build the trust. And remember, at 5 or 6 years old, the EPIET program was being questioned whether it should continue. I don't think anybody would question its success now. So don't give up hope. And just to look at the EPIET, so it's the EPIET program and the EUPHEM program, the training program in public health microbiology. This just shows the trend over the 20-year period, 95 to 2015. You can see the growing numbers of fellows and also the changing distribution, increasing numbers of fellows in allied programs or field epidemiology training programs run at a national level, the introduction of the public health microbiology program, and the introduction of what we call the member state track, where fellows train in their own country. And the bottom line to this is that there have been 462 fellows either graduated or are still in the training program. That's an impressive output. And yes, you start small, but many of those fellows now, in fact, one of the fellows of the first cohort is currently the acting director of ECDC. There are many other fellows that have very important roles at a national level across Europe. And I hope that in 10 or 15 years' time, we'll be seeing the same of you as the first or second MediPIET fellows. And field epidemiology training fellows, such as yourselves, you have a key role in not only learning, but actually applying public health science in the field. So in terms of EPIET and EUPHEM, the EPIET fellows have been involved in the evaluation of the disease networks that was undertaken in 2006-2007, very much involved in national surveillance, evaluating and setting up new systems, and have played a key role in some of the work we've done in setting up molecular typing platforms for food and waterborne disease surveillance. And these are just a few of the examples that have been involved, EPIET fellows. FETP fellows, EPIET fellows also have a key role in strengthening response capacity. The EPIET program initially, we engaged in that through our association with MSF and go on, but increasingly, and Ebola is a nice example of that, it's ECDC has directed the deployment of our fellows to international missions, and we now have a complex emergency situations course as part of the EPIET program. And again, just a few examples of where EPIET and EUPHEM and other fellows have been involved in international responses, ranging from mortality surveys in Darfur, and I remember that very well from my days when I was chairing the EPIET program, to the 2004 tsunami follow-up, dealing with earthquake-related issues, pandemic H1N1, vaccine coverage surveys, the Ebola response most recently. These are not only important learning opportunities for fellows, but fellows make a real difference through what you can give in these situations. And this just shows how the EPIET program has supported international response over the many years. So, following in the footsteps of Snow and Farr, two personal heroes. Who are going to be, where's the next John Snow and the next William Farr going to come from? Well, it's going to come from all of you. This is a photograph of the 2014 EPIET EUPHEM introductory course, but it will come from, this is where the next John Snow and William Farr will come from. It'll come from people in this room. And like you said, hopefully it'll be a woman. We'll have a Josephine and a Wilhelmina in the future, not just a John and a William. So with that, I'd like to thank you.